Welcome to the Care Right podcast, your go-to resource for all things elder care. Guiding us through this journey is Annalee Kruger, the founder of Care Right Incorporated, and she has been steadfastly supporting families across the United States. Each episode brings you expert insights, innovative strategies, and practical advice, ensuring that you're well equipped to provide the best possible care for your loved ones. Expect to gain valuable knowledge, learn from real-life stories, and get inspired to take action in your own caregiving journey. So buckle up as we dive into an in-depth discussion of elder care planning and together embrace the journey of caring for aging loved ones on the Care Right podcast.
Welcome to today's podcast. I'm Carl Frank with A&I Wealth Management, and with me is Nathan Merrill. How are you, my friend?
I'm back, and I'm stronger than ever.
You were sick for a little while there.
I had a little aging issue myself, I think.
You did. I don't know that it was aging so much, but it sounded like really painful.
Yeah, it was.
Oh, you poor guy.
But I'm back. We're good. I can talk.
Your law firm is still in business without you being there.
Yeah, it was just a couple weeks, so
No big deal.
no big deal.
There are a lot of attorneys propagating this building now. It's not just you and Susan.
We are filling the place up for sure.
Great. Well, also virtually in the room is our guest today, Annalee Kruger. Hello, Annalee.
Hi.
So happy to have you. Thanks for joining us. It's going to be great. Our topic today is aging planning, and this is a priority for me. I am both excited and terrified about aging, and for my clients at A&I Wealth Management, and for my own family, and Nate, I think you're seeing this with your clients as well. I mean, we were just talking right before we hit the record button about how important this is, and putting together a plan for that will help us do it with independence and dignity and everything that means the most to us. So, Annalee, you are a national expert. You're my expert on it. You are the one who taught me last year. I went through a 10-week certification program, which you led on building elder plans for financial planners like myself, and we had a bunch of great speakers, but you were probably my favorite and definitely one of the two founders of that. You were wonderful at that. So can't wait for you to share some of your experience and expertise with our audience. So thank you for joining us.
Thank you. Thank you. Happy to be here tonight. So this is great.
Perhaps you can kick off just by telling us a little bit about kind of, I don't know if it'd be your credentials or how you got involved in this line of work, and how what you do is unique in that space.
Sure. So and I'm not going to go through like in 1911. So, but like when I was growing up, so I grew up in the 70s, like I was born in the 70s. And back then there were only options for like our grandparents to either move in the nursing home or move in with their parent or with their kids, or fail at home and die at home, because we didn't have assisted living. We didn't really have home care back then and all that kind of stuff. So both sets of my grandparents actually moved in with us on the farm in Iowa. And so we were able to keep them out of the nursing home, because back then we didn't have resident rights in nursing homes. So it was like a very, very not a place anybody wants to go to, and it still is not. So don't get me wrong. But I grew up with elderly people in our life, and it was just so much fun. But it also taught me like how to be a caregiver as well. You know, I had to help take care of grandma. I had to help take care of my grandfather. And so I ended up going into social work, gerontology and social work. And I started out working as an activity assistant in nursing homes, but then I became a social worker and eventually an executive director in what's called CCRCs, continuing care retirement communities, that have all of those different levels of care, like independent living, assisted living, memory care, skilled rehab, and skilled nursing. And back then, so I'm 51. So back then in the 90s, one person did the entire campus as far as like social work, marketing, and executive director. So it was like a big responsibility. But part of my job was always to do the tours. So every single day for 20 years or over 20 years, I had families coming into my office because mom was in the hospital. She had a stroke. She's the primary caregiver to dad with dementia. And the kids were always blindsided because they're like, oh my gosh, we don't know what to do with mom. Dad can't stay at home by himself. But back then, what was easier, in quotes for those listening, what was easier was families lived down the street from each other. So they kind of would tag team mom and dad and be able to help. And they were much more involved and included in the day-to-day operations, because a lot of times the adult kids would have to step in as a caregiver. But when the families would come in to take a tour because mom's in the hospital says, here's a list of facilities, go find one by noon tomorrow because we're discharging your mom. The kids had no idea what questions to ask. They had no idea what to look for. They're just in total shock, and they're blindsided because now they're forced into making really big decisions quickly, and no one ever feels ready or confident in that. So the tours would take about an hour, but I was spending 2 and 3 hours at a time with each family because they're like, I don't even know what to look for. I don't know what to ask about. When I would ask them, do your parents have a living will, a power of attorney, long-term care insurance? All of those questions were responded to with, I don't know. Our family never talks about stuff like that. But then there were like this many teeny tiny percentage of adult kids who would say, Annalee, we tried to get this information from mom and dad before because this is our 4th hospital stay or whatever, but they gave us so much pushback about sharing that information with us that we quit trying because then our relationship was starting to get strained. Well, here they are in the facility and they're like, we don't even know what the difference is between independent living, assisted living. We think Medicare is going to pay for everything always. And they didn't understand dementia. I used to run memory care. I used to run early to late, early all the way to mid and late stage dementia. And these families just had no idea what to expect with this disease process. So there was a lot of coaching and consulting and just educating the families because they just were so ill-equipped. So in 2011, I decided to leave corporate America, and I'm not too ashamed to say that if I wasn't going to leave on my own, I was going to get fired because my boss did not like that I was spending so much time with the families and so much time with the residents. These care communities have calculations or equations on how many minutes per day per patient. And I was like totally blowing that out of the water. So they're like, you're spending too much time with these families. And I said, well, that's because they
Don't do
need it.
that.
Because they're falling through the cracks of the healthcare system. It's like, shame on the healthcare system. These families will get this diagnosis of Parkinson's or frontal temporal lobe dementia. And then it's like, okay, good luck to you. Good luck figuring out what to do next and what kind of care you're going to need and how expensive it's going to be. So in 2011, I decided that I felt like I was very confident, and I was correct, that I could reach more families globally and actually handhold them virtually through the aging, caregiving, and dementia progression and end of life journey. So that's what we do. I started my own consultancy, CareRight Incorporated, in 2011 because I already had over 25 years of baseline data to know that there's a massive gap. Like, no one is doing this type of planning for families. They're just literally falling through the cracks of every system out there. And so I am hell-bent and on a crusade to make sure that every family that I can encounter and have the blessing of getting to know will have an actual comprehensive, viable, sustainable aging plan.
So, yeah, so just the normal flow of things, I think, is, and we've got all the components here. People go in and see Carl and talk about putting a financial plan together. I want to make sure I can retire comfortably.
Right. I have enough money.
I want to make sure I have enough money. And then Carl says, well, do you have an estate plan? I'm sure you're now asking, do you have a aging plan? But this is the historical approach, is they come to us then and they get themselves an estate plan. You've already mentioned some of those documents: powers of attorney, living will, trusts, that sort of stuff. So we get all that stuff squared away, and that stuff's certainly important. But perhaps you can then talk a little bit about, or now talk a little bit about, how does the aging plan plug into that financial plan and estate plan to bring it all together to make it work?
Because I am here to tell you, with now over 35 years of working with families, that if every family had an aging plan, which is understanding what the disease process is that they're dealing with, so that they actually understand what dementia will mean to their loved one and the emotional and behavioral changes and personality changes. So when I talk about an aging plan, it's helping families understand what's working well. Like they tell me what is working well in your day, what's not working well in your day. I have a whole process that I use when I'm facilitating the family meetings. What are the health issues? What are the diagnoses? And what are the care options based on what they can afford? And the reason why the aging plan is so critical is because it's the day-to-day stuff that I deal with that can derail the financial well-being of not only the adult kids, but also the parents. Meaning, say daughter Sally got thrust into the role of caregiving for dad because dad had a stroke and mom has dementia. And so a lot of these families are not taking the job promotion because they just simply don't have enough energy and bandwidth. Because I'm here to tell you, it is a full-time job taking care
Mhm.
of two aging parents. And a lot of my clients are actually power of attorney or caregivers for up to 6 elderly people, because you got the in-laws, the blended families, and they may or may not like their in-laws, but they got, got volunteered to, like, okay, you're gonna have to take your mother-in-law to the doctor. And that doesn't work very well because that's when resentment hits in. But it's when families don't have a plan that it derails their financial plan, because if daughter Sally doesn't take the job promotion, or she feels like she has to take early retirement, or she is just so burned out emotionally and physically from being a caregiver, that she can't like function well in her job and she loses her job, or she decides to take a menial position because she needs the flexibility to become a caregiver, that all affects the financial plan. That also affects the family legacy. You know, you would hope that the aging process would bring families together, and I am here to tell you that it does not. If they don't understand the disease, if the family doesn't communicate effectively and productively together, and they don't understand the disease process, and they don't understand the cost of care and the different levels of care, they certainly can't make informed decisions when they're making decisions off of bad information. For
Okay.
example,
So if I can just ask you a question there, because I imagine there's a whole lot more we're going to go through, but just to drill down a little bit here, what do you do in order to help someone understand the aging process, or the, what do you call it, the disease or something like that? And I assume there's more than just dementia at play here, but there could be cancer, or, even just the falls that people will incur.
Yeah, all that.
So what do you do? How do you make sure that the family is communicated to or educated on whatever the disease
because
is?
we facilitate their family meeting and educate them. So our family meetings, it's at least 5 hours of family meetings, because they're just coming to us so hurting, meaning they're burned out, they're not communicating, they're really resentful of each other. Like, they thought that brother John would pitch in more and help, and he's not, And so it's through educating them through these family meetings. I also do 25 webinars a month to consumers and to other professionals. I wrote a book called The Invisible Patient: The Emotional, Financial, and Physical Toll on Family Caregivers. And I also have a free Facebook group for family caregivers, where I then even do more education as well for those folks. So it is educating them so that they understand the changes that they can expect in their loved one through the aging process and through dementia. Example, a lot of our sons and daughters will say, I can't believe dad can't set up his own medications or coordinate his own doctor's appointments or make better decisions. He was a sergeant in the army, and how come he can't do the things he used to do, right? So the kids are still looking at their parent as in a different role in which they are now. Now mom and dad are frail, they have dementia, they need help, they need care coordination. My dad is 86 and he lives with me, and he's alert and oriented, but he's hard of hearing. And just even coordinating his VA appointments, there's no way he would be able to navigate the phone system because there's accents. They don't speak clearly on there, and he's hard of hearing, and they talk super fast. So there's no way. And so that's what I'm talking about, is all those things families don't understand. Or the son will say, well, I don't understand why you have to take a whole day off of work because mom has a doctor's appointment. Well, because you have to come over, make sure mom is toileted, fed, had her medications, then she has to go to the bathroom again, then you need to load her up in the wheelchair. It just is time consuming, and then you have to wait for the appointment, and then if the doctor changes medications, then you have to go to the pharmacy. Like, it takes an entire day, and adult kids don't understand that, and so in time they get really angry at their parent or resentful of their parent, even though it's not the parent's fault, because as the three of us age, we're going to be in the same boat. We just slow down. We don't get healthier and more cognizant and more able-bodied as we age. It goes the opposite way. And so sometimes kids just need that gentle, loving reminder that, your parent is 70 or 80 or 90 years old. They're not a military sergeant anymore.
Right. No kidding.
Do you do those meetings over Zoom or in person, or what's your preference?
So Zoom, because I'm a global family consultant, and I actually built my company intentionally in 2011 to be virtual, because my mom ended up with early onset dementia, and I'm incredibly close. My family is very close. And so that way I knew that I would be able to participate in her care and take care of her, and make sure my dad didn't get burned out. And that way, as long as I had the internet, I could be in Iowa and helping my parents and not have to worry about like what's going on in where I lived in Milwaukee. So I intentionally set care right up to be virtual. Back then in 2011, we only had Skype, but now we use Zoom.
Got it. And how do you do things to ensure engagement and participation? Like, is there homework and surveys and things like that you have people do?
So what we do is we'll do like a care. What we don't give our clients too much homework, because unfortunately by the time they come to us, they're already burned out and they're overwhelmed and they truly don't have emotional bandwidth left. I mean,
Got it.
oftentimes the care recipient is usually in better shape, like better shape than the
Yes.
caregivers, because they're that burned out. And so when we do give them for homework, if you will, as part of our aging plan process is through the course of these different family meetings, and I meet with the siblings separately. At first, I meet with the adult, the parents separately, the primary caregiver separately, so that everyone has a chance to talk openly. Because you can't expect Marvin to talk openly about his wife Ethel when she's sitting right there. If she's got a stroke and he's wearing out, he's not going to admit that if she's sitting right there. So through the course of these various family meetings, we talk about the pros and cons of aging in place at home. Mom and dad want to always age in place at home, and they don't want to be a burden on their kids. Those are those two goals.
Hmm.
But when I ask the adult kids, what are your goals for your parents? It's always a variation of the same thing. We love our parents. So we want our parents to be safe. We want them to be happy. We want them to have the best quality of life possible and the best quality of care possible. So the only logical way to incorporate and marry all those goals is putting an actual plan together. So logically it makes sense, but some people are just they're so burned out and they're so overwhelmed and they're so much in they're in like survival mode, trying to just get through their day of the family caregiving responsibilities. Maybe they have a kid with special needs, and they work full time. They have a lot on their plate. And so when we give them homework, it's through the course of working together, we give them the tools for success, which are a variety of different checklists, like how to tour care facilities with confidence. So it's like an 8-page checklist. I typed all this up because that's one of the reasons I started my company, right? So we also give them how to be a bold advocate, because we do advocacy, but we don't know in the beginning of working with a family if they're going to stay on our care services, like our care packages, where we help them implement the aging plan and oversee it. Kind of like Carl with financial planners, they pay you to put that financial plan in place, but then they stay on your services, what we call caseload. They stay on our services so that we can guide them and implement that plan and oversee it and tweak it. But we also take it one step further, because we also provide that medical care advocacy to make sure that mom and dad are getting the best care possible, whether it's from the home care agencies, hospitals, or senior care facilities.
Got it. That was actually, I think you just answered my next question, which is, so if there's not a lot of homework, what are the deliverables? But it sounds like you give some checklists, and do you like summarize some of the conversations?
Oh, yeah. So the
and
aging plan is usually about 30 pages. because this is hours of family meetings. Not, I
And
don't
that's
want
all
the list.
derived from the meetings?
That's
That 30
so the
pages?
meetings, yeah. So, well, like 8 to 10 pages ish are
Okay.
actually from the family meetings, because it's all a summary of the family meetings. Then it's a whole list of what are the gaps. So we talked about, well, you don't have your estate documents in order, or daughter Sally, now that she realizes Medicare doesn't pay for all of mom and dad's care, she's like, ooh, I need to learn more about long-term care insurance. Or maybe they need to sell their house so they can afford to move into a care community. Then I have realtors in my network, and I have a very robust, curated, professional Rolodex.
Got it.
You guys are old enough to know what a Rolodex is, but it just occurred to me, I don't know how old your listeners are.
It's the contacts button on your phone for
I know,
those
did you guys
who.
see that face? I'm like, oh wait, I don't know how old his listeners are. But so they also have a list of like, here's phase
That's
one, phase
great.
two. Like phase one might be start touring these care communities that we do on the care matrix. Or get your estate documents in order because mom is losing capacity by the minute because she's got, Huntington's disease or something like that. So their deliverable is specifically, here's how you can age in place at home. Here are home care resources in your area. Here's how much they charge. Here's what their shift minimums are. That care matrix, I want to just go into that a little bit because I know I'm referencing it and everybody's like, well, what is a care matrix? So a care matrix is a done for you project that we do for our families. We do about 40-ish family care matrix projects per week for families across the country. And why I say it's a done for you is through the course of the discovery meetings with the families, I learn what is working well, what's not working well, what are the diseases. But we all know that even though aging in place at home is always the goal, it's not always feasible, safe, or affordable. And so this way, they at least have the list of, here are senior realtors in your area, here are home care companies, and this is how much they charge, and these are the ones that actually have staff right now that you could call to get started on services. Or here's a certified aging in place specialist, someone that can walk through your house and be like, okay, you need to lift up the carpet, or whatever it is to make that senior house safe. But the care matrix also includes care communities. And here's the different levels of care. Here's the ones that you can afford to move into. We look at the state surveys for the last 3 years because that gives us a theme of how well do they take care of their residents. What's their waiting list for each level of care? How sick can you be and still stay in assisted living? Because every state's a little bit different on what those requirements are. But the reason why the care matrix is critical is because, again, I spent over 20 years as an employee in these continuing care communities. And every single day I had families coming in that maybe their parent couldn't afford to move in to our facility, or we had a 4-year waiting list in our memory care facility, and now they just wasted 3 hours on a tour. And so because I know that 92% of my clients come to me in crisis mode, they don't have the luxury of time to dink around touring facilities and then find out, oh, I just toured 4 facilities and wasted all day, and I have nothing to show for it because mom and dad don't qualify to get in there, or there's a 4-year waiting list and mom and dad need to move like next month. So that care matrix is critical. So that's the deliverable. So they have an outline of current care options and future care options, just in case staying at home is no longer feasible. What families don't appreciate is that their parent has to financially qualify, physically qualify, cognitively qualify, and behaviorally qualify to get into these different care communities. And because moms and dads want to age in place at home so bad, sometimes what happens, and this affects Carl, the financial planning piece of it, sometimes because they're misinformed or uneducated, what they don't realize is the current care decisions that they make today will affect and potentially jeopardize their future care options. So meaning, say they have $500,000 and they decide that they want to stay at home. Well, they need 2 caregivers. That could be $40,000 a month to stay at home, and they don't realize that. Well, they might drain their account trying to stay at home, and now they don't financially qualify to get into a quality care community, or mom and dad no longer physically qualify for assisted living. Now they only physically qualify and sometimes financially qualify because now they need to look at Medicaid. Now they only financially or physically qualify for a nursing home, and that is a very, very different look and feel and price tag than assisted
Mhm.
living. So those are the conversations that we have through those family meetings, because you can't expect misinformed people to make informed decisions when they're making decisions off of bad information. So
Or even just emotional,
Oh,
because
that's
it is
right.
very emotional.
It is
that's the
very
biggest
emotional.
part of it. Yeah.
The sad thing is 92, just to give you, because you guys are probably a number of people, so you might like this, but 92% of our clients, despite my mission originally with Care Right was to reach all these families proactively. However, that said, 92% of our families come to us in crisis mode. 85% of those families, I'm doing family mediation with them because their relationships are so strained. But the ironic part of that is most of the mediation I'm doing with the families is simply because they didn't know how to communicate well. They didn't understand the disease process. They didn't understand why dad is acting the way he is because he has dementia, and they're just in denial. And they're like, well, no, he's just being difficult. No, he actually has dementia. Or they didn't understand the whole aging process or how much care costs. So, like, a lot of our daughters will say, I'm burning through my FMLA, or I'm not taking the job promotion because mom and dad need so much of my time and attention. But my brother doesn't listen to me. He's like, "Oh, just pull up your big girl panties and just you're fine. You're just making a big deal out of nothing." Well, no, she's not. And so then I encourage those families. I'm like, keep a spreadsheet, run it like a business. Keep a spreadsheet of how much time, how many missed days of work, how much missed opportunities did you have, how many doctor's appointments, like keep a log, keep a spreadsheet of all of this, so that when that brother or sibling is like, you're not doing, like, I don't know why you're complaining about all of this. You can say, well, here, dad had 4 doctor's appointments this week. I do all this for my dad too. And it's a lot of work.
Right.
It's a full-time job taking care of someone and coordinating their care, and then still trying to keep your business afloat and your personal life afloat as well.
Right.
Annalee, this is a great conversation. Let's break for this podcast and
Sure.
and continue it on the next one. I'm really interested in
Get into
that.
the details.
Yeah, some
Can
of
I
these great details and practical
Can I
advice.
Can I just say one more thing? Because you asked what the
Please.
deliverable is. So, like, the first 8 to 10, 12-ish pages are specifically customized to what our family needs, because they're all coming to us with a variation of the same problem. But because we don't know when we're starting to work with a family if they're going to stay on our services or if they're going to be a do-it-yourselfer. It's like, here's your aging plan. So here's like different technology solutions you can employ. Here's what geriatric care managers can do. Here's the value of home care. Because all those tools for success I talked about, it also includes like how to interview a home care company, the difference between actual employees of a home care company versus like 1099s, and like the things that they need to watch out for, like liability and those kind of things. Because we don't know if they're going to stay on our services. This way, at least I know that I have armed them with as much information as I can if they decide to be a do-it-yourselfer. That said, those families who are like, oh, we got this, we can implement the plan, we'll call the attorney, we'll call the realtor, we'll get the home care started. When we check in with them 30, 60 days later, I'm like, hey, how are you coming with a plan? They're like, we haven't touched it because dad fell again, or something always happens. And so then they end up back on our services, except this time how they should have been in the first place, which is on our care package service, so that we can make sure that they get that plan implemented. Otherwise, they went through this whole process for no reason.
Right.
What a great offering. I can't wait to get into some practical advice, and especially, for the 3 of us, we are caregivers. So this will be really applicable in our own lives.
Yeah.
Thank you.
Absolutely. Yeah. Thank you.
All right. Talk soon.
Thank you for tuning into the Care Right podcast. We hope today's discussion has provided you with valuable insights. If so, don't forget to like, subscribe, and share our podcast with others who might find it helpful. Remember, Care Right is more than just a podcast. It's a community dedicated to supporting family caregivers with comprehensive care planning, crisis management, and resources for every stage of aging. Stay connected with us for future episodes as we continue to explore essential topics in aging planning, elder care, and financial planning. Until next time, take care, plan wisely, and remember, you're not alone in your caregiving journey.